Guys, welcome back to another video. So today we'll be discussing acute glomerulonephritis. So what is this? This is the sudden inflammation of the glomeruli, the kidneys, tiny filters, usually occurring after a streptococcal infection. What really happens in this condition is that you get recurrent or untreated streptococcal infection. Then the immune system will create an antigen antibody complex, and this usually happens 14 days after the infection. So the complex circulates all over the body, but unfortunately the antibodies get stuck in the glomeruli. So once they get stuck, the glomeruli will start getting inflamed and scarring occurs. So what happens after this? Well, there will be leakage of red blood cells and proteins, and also decrease in the GFR. Happens after the red blood cells and protein leak out of the kidneys, we'll get hematuria and proteinuria. But remember, the proteinuria will be mild, not like in the other condition, nephrotic syndrome. So when the GFR decreases, there will be fluid volume overload and also hypertension. So to remember the signs and symptoms, use a fun mnemonic, HAD STREP. So the patient will show hypertension. They will also have an increase in the ASO titer, which shows an evidence of recent strep infection. The patient will have decreased urine output or oliguria. There'll be swelling of the face, eyes, and hands. This is edema. Tea-colored urine, that is hematuria, and also a recent strep infection. The BUN and creatinine will be elevated and the patient will have protein in urine. What's the treatment of choice when the patient has these conditions? You give them antibiotics to treat the underlying infection, and the first antibiotic of choice is penicillin. You also give antihypertensive, that is ARBs or ACE inhibitors. Next, you have diuretics to get rid of the fluid volume overload. The patient is also put on bed rest in order to reduce the metabolic demands of the kidney. The patient is also put on a low protein, high carbs diet. Also monitor the input-output to see whether the fluid overload is resolving or not. Thank you guys. Don't forget to like, comment, and subscribe.